So today I will talk about some of the neuroendocrine effects in the psychedelic effects in headache disorders. First, I just wanted to thank the different foundations involved with supporting this research. The Wallace Foundation, CH-TAC, and also Cluster Busters. These are foundations that have interest in studying headache disorders and also psychedelics. So my ongoing trials are ongoing. They're almost finished. So I unfortunately don't have those final data to talk about today, but instead I want to touch on a certain idea as to how psychedelics might be helpful in headache disorders. So first I'll talk about psychedelics as medicines for headache disorders, especially cluster headache. This is where most of the anecdotal data exist. And then I'll talk about some of the neuroendocrine problems in cluster headache and what effects psychedelics have on those systems. We don't have direct evidence of these effects in cluster headache, but through various many hours of looking in the literature, there are some stuff out there on the hypothalamus, different hormones, and sleep and the circadian rhythm. So first, I just want to show our two friends here, psilocybin and lysergic acid diethylamide. Psilocybin is chemically very similar to melatonin. It has the indolamine ring, very structurally similar, and it's used to treat headache disorders as well. Sumatriptan is also an anti-headache medication. This is used to treat one single headache. It too has an indolamine structure and is very similar to psilocybin. LSD is a more complex compound. It's an ergot, as is methysergide, which is an older headache preventive medication that's no longer available because it causes fibrosis in tissues with long-term use. But patients raved about how great this medication was for headache. Another ergotamine is dihydroergotamine, or DHE, which is still currently used in the treatment of different headache disorders, including cluster headache. So there have been many reports, and these aren't all of them. These are just some of the more recent reports, patients talking about using psychedelics to help treat cluster headache, and also a couple with migraine headache as well. These are surveys and case reports of patients talking about the sustained long-term effects of using psychedelics, small amounts, over a short period, having long-term effects. Nothing else out there does that for headache disorders right now. You may ask, why do cluster headache patients even bother with this? Isn't it dangerous to take an illegal substance? And one of the main reasons is that while there are medications to help treat cluster headache, they're not very effective. They have a lot of side effects, and some patients can't get them because of insurance coverage and such. And even if they can get them, they have to take them long term. And the reason why patients are pretty desperate to try to find better treatment, this is one of the reasons. This is a one-page case report of a patient with cluster headache who actually shot himself during a cluster attack. Cluster attacks happen behind one eye, and he shot himself. He actually survived. He did not get rid of his cluster headache, unfortunately. These are the scout images from his CAT scan showing the fragments of the bullet both inside and on the outside of the brain. The case report says he had no neurologic deficits when he was discharged, so I'm guessing most of it was on the outside. But this is not an isolated case. You'll hear of patients either shooting themselves or using other objects. The pain in cluster headache is that severe. So the characteristic paroxysm in cluster headache is the cluster attack. And this is a picture from one of the earlier papers from Horton showing they didn't have Photoshop back then, but they somehow modified it to look more extreme. But in general, there's severe pain on one side of the face, and there's associated parasympathetic activation causing ptosis, meiosis, red eyes, tearing eyes, stuffy sinuses, and sweating on the face. And again, they didn't have Photoshop back then, but someone must have drawn that in because it's actually not that severe. During a cluster attack, as you can imagine, patients can't lie still. Unlike other headache disorders where patients just want to lie down in a dark room, patients can't help but to move around. And they also may do self-injurious behaviors like the one that you just saw. Patients hitting themselves in the head, hitting their eye, cutting other parts of their body to try to distract from the pain. Thankfully, cluster attacks don't last as long as other headaches, so they last from 15 minutes to about 3 hours, but 3 hours of the most severe pain experienced by humans is pretty bad. Cluster attacks can also happen multiple times a day, up to 8 times officially, though there are patients who have more. And as I mentioned, a cluster attack is severely painful, and they've asked patients who have cluster headache and who have given birth and cluster headache and who have had kidney stones, which is more painful, and they all say cluster attacks are more painful. So that's why patients are pretty desperate to try to find treatment because those available are not really optimized. So cluster headache is named cluster headache because the attacks tend to happen certain times of year in these cycles. And this is one patient's diary showing the days of his cycle down here. It's about 2 months long, and the hours of the day. And he drew each one of his attacks. You see he has multiple attacks. When the cycle starts, he has just a couple attacks. The height of the box is the duration of the attack, and the color is how severe it is. So the blues and greens are milder attacks, and then the reds and blacks are really severe attacks. So you see that when his cycle starts out, he's got a couple attacks that are more mild, and then they get more severe. And they tend to also cluster around certain times of the day. So in his case, it's during the daytime from 9 a.m. to 9 p.m. roughly. And then as his cycle ends, he has fewer attacks, less severe, and then it kind of goes off. Most people do have these cycles. Most of them have it in the spring and fall, but that can be only once a year. They may skip years. This patient reliably had cluster cycles every 2 years. So his next cycle, he decided to try psilocybin mushrooms. And so he got started on his cycle just like normal. Pretty severe cycle. He has a lot of red and black when he took a low dose of psilocybin. And you see that right away his headaches went from red and black to blue and yellow, so less severe. That lasted a couple of days, but then a couple of days later, his attacks got worse again. And so he took a relatively high dose of psilocybin, and after a few days, he had no more attacks. So from his first dose and his second dose, about a week long, he got rid of the cycle that would normally last 2 months long. And there's no other medication out there that can give such a dramatic effect with such limited dosing. So Cluster Busters is a patient advocacy group for cluster headache. They talk about psychedelics, but also talk about high-flow oxygen, one of the acute treatments for cluster headache, and some other things. They ran a survey many years ago, and among the many questions they asked of these different preventive medications, what's most effective. So the medications that they asked are listed on the x-axis. The more commonly used medications like verapamil, prednisone, Topamax are on the left, and then the right are the less commonly used or less available medications. And then out of 100% of people who tried that medication, we showed how many people rated it as completely effective, which is the black, moderately effective, the sort of dark gray, partially effective, the light gray, and then not effective at all, the lightest gray. So the medications with the most black and dark gray were the most effective. So the ones that kind of stand out, the ones that are more commonly used, verapamil and the prednisone, are pretty good, but those are medications that you have to take every day, multiple times a day, and of course no one likes the effects of being on chronic steroids. The other ones that stand out, and this is sort of best if we look from far away, psilocybin, lysergic acid amide, which is a psychedelic found in the seeds of certain flowering plants, such as morning glory, LSD, DMT, BOL. BOL here, only 10 patients tried it, but half of them found it completely effective, and then one other found it sort of moderately effective. BOL is bromo-LSD, so the LSD molecule with the bromide stuck onto it. And this is a very interesting compound because bromo-LSD does not have psychedelic effects. It still binds the serotonin to a receptor, but it does not have the psychedelic effects. There are some drug effects. People may feel drunk while on it, but none of the psychedelic effects LSD. So speaking to that, patients have also reported using sub-hallucinogenic doses of LSD to help stop their cluster headache. In one survey, 2 patients used low doses of LSD to help stop their attacks for a couple of weeks at a time. The range of doses that patients used of psilocybin to help stop cluster attacks ranged from 0.1 grams, which is very psychedelic, up to 5 grams, of course, very psychedelic. And then in the chart that I just showed with the BOL, about half of patients found that it prevented their cluster attacks. And about a decade ago, there was a study out of Germany with Thorsten Passy showing in a case series patients receiving BOL, their number of attacks per week dramatically going down after treatment, and going out to 16 weeks, the effect is still there. The BOL in this study was dosed 3 times about 5 days apart, and that's the busting regimen that cluster headache patients talk about. They'll take either LSD or psilocybin or another compound such as BOL in this regimen of taking it three times about 5 days apart each. And there's some variability, but that's sort of generally how people take it. This sort of pulse regimen of taking something is not dissimilar from some other headache treatments, such as DHE, which I mentioned before, one of the ergotamines, which is taken a little bit of a longer pulse, but is taken 3 times a day for 5 days to help break someone from their cycle, or it can also be used in other headache disorders as well. Steroids are also used as a pulse regimen, but those are given a couple times a day over weeks. And sometimes cluster headache patients end up staying on it for months or even years at a time, unfortunately, because it doesn't work as well as psychedelics. So this, of course, I found very interesting. No other compound out there can you take in such small amounts and have such a lasting effect in such a devastating pain disorder. So currently, I am looking at that in a clinical trial, and shortly I should be able to talk about that. Not here, but in the future. So as to one of the ideas behind why psychedelics might be doing this amazing thing, I just want to give a really quick background on what headache is. Pain in the face and the head and the neck are sensed by 2 nerves, the occipital nerve and the trigeminal nerve. The occipital nerve feels the back, and the trigeminal nerve feels the front and the blood vessels and the dura surrounding the brain. And the cell bodies of the occipital and trigeminal nerves live in the brainstem, and they talk to each other in this trigemino-cervical complex, and then they go up a higher order, as we sort of learned about in the last talk, higher order, all the way up to the cortex, where it's perceived as pain. And one of these structures that this sensation passes through is the hypothalamus. And these are functional imaging pictures of patients either during a cluster attack, which I'm not sure how they were able to lie still in the machine for this, or during a cluster cycle or shortly after a cluster attack, showing that the posterior inferior hypothalamus is indeed activated in patients who have cluster headache. And this has been repeated in multiple studies. Very refractory patients actually have deep brain stimulation of this area to help control cluster headache if other medications don't work. So this is reliably, this is an area that's involved in cluster headache. So, and I'm not going to go into everything about the HPA axis because that's a whole topic in and of itself, but in general, the hypothalamus makes the hormones or the hormone stimulators that then go into the pituitary gland that then release the hormones and have different effects in the body. In this picture, it's talking about the about cortisol response, where adrenocorticotropic hormone stimulates release of cortisol from the adrenal gland, and this leads to the fight or flight response. Of course, there are many other hormones involved: thyroid hormone, follicle-stimulating hormone, but this is just an example of one of those. Another part of the brain that's also involved in cluster headache is the pineal gland here. And it's not really shown well in this picture, but one of the nuclei of the hypothalamus, the suprachiasmatic nucleus, which receives light input from the eyes, then speaks to the pineal gland, and that sort of sets your sort of day-night rhythm. The pineal gland releases melatonin, which is known as the sleep hormone, but it also regulates other circadian functions. So, and again, it's not really shown in this picture here, but this is just showing the general anatomy that sort of sets our clock. So what do psychedelics do to the hypothalamus? Well, there's not a whole lot out there, but there are still some findings. Functional imaging shows that in rats who are given psilocin, which is the active metabolite of psilocybin, a low dose doesn't do anything here, but a higher dose does activate regions of the brain which include the hypothalamus. In humans, intravenous psilocybin decreased activity in the areas where the hypothalamus is. Again, there are a lot of areas that are involved in these pictures, but one of them does involve the hypothalamus. So there is activity going on. If you think about cluster headache patients having an overactive hypothalamus, quieting it down would not be a bad thing. Some older studies also looked at hypothalamus tissue from rats, and in this older study, those tissue slices were labeled with radioactive serotonin, and when LSD was applied, it actually decreased the amount of radioactive serotonin being released. In the two posterior hypothalamic nuclei, this is again kind of an older study, but when LSD was applied directly, it didn't change the neurosecretory materials from those tissues, but when given to the rats chronically over 2 weeks, there were changes. Patients don't take LSD every day for 2 weeks. They take it once every couple of days, so somewhere in between these two, the acute and the chronic. But again, what's out there is sort of limited, so this is what we have to go on for right now. So the next part is about hormones, which is, of course, directly related to the hypothalamus. So there are many hormones that are abnormal in cluster headache, and I'll just touch on a couple. Baseline levels of cortisol, they are higher in patients who have cluster headache, and melatonin is also lower in patients who have cluster headache. In this graph, the dark bar shows the average melatonin release and the timing of that release over the course of the day in the average patient. In cluster headache patients, you see that it's much lower, and it's also shifted a little bit forward. So the peak here happens before the peak in the general population. So there are some there's abnormalities there. Prolactin, testosterone, oxytocin, hypocretin, there are some other hormones that have some abnormalities either in hormone levels or the hormone receptor itself in cluster headache. Again, that talk would take a whole hour, so this is just to kind of touch on that there are abnormalities there. And what do psychedelics do to affect hormone levels? Well, for cortisol, at least, there are several studies that have shown that LSD, psilocybin, ayahuasca, DMT do increase serum cortisol, and also the stimulator for cortisol, ACTH, in humans. The same happened in rats with DOI and DOB. Just as a reminder, DOI is one of the substituted amphetamines that are chemically similar to mescaline. It's used a lot in research, especially as a serotonin 2A agonist and as a model for psychedelic for the effects of psychedelics. So that also increased ACTH and the rat equivalent of cortisol in rats. About melatonin, this was an older study as well, looking at rat pineal tissue and looking at the effects of mescaline, psilocybin, and LSD on the pineal tissue. So it seems that lower doses, but not higher doses, stimulated melatonin release with all three of these compounds. Of note, the indolamine psychedelics like psilocybin and like LSD are helpful in cluster headache, but the phenethylamine ones like mescaline or like DOI, not so much. So while mescaline does release melatonin here, that's not enough for it to help in cluster headache. So another topic to talk about in cluster headache is the sleep cycle. I just talked about melatonin, which helps regulate sleep. This is a polysomnogram of a cluster headache patient in sleep. That's where they're hooked up and they measure brain activity, waking, REM sleep, the slower wave sleep and the deep sleep. And this is when the patient enters each of those. This patient tended to have cluster attacks, that's where the arrows are, during deep sleep, but also during REM sleep. It's more common for patients in cluster headache to have cluster attacks out of REM sleep. Cluster headache patients don't sleep very well because they're always getting woken up every 90 minutes with an attack. So, and what's been found in cluster headache is that the REM periods in patients who have cluster headache are somewhat decreased. And this is, you have to take this with the fact that they're being woken up a lot overnight. This finding is not found in all patients, however, but there have been several studies showing decreased REM. And as I mentioned before, some patients will get deep brain stimulation in their posterior hypothalamus to help treat cluster headache. This also can help correct some of the sleep problems that they have, but it can make other sleep problems worse. So there's that. So what do psychedelics do for sleep? This is just some of the studies that I found. In rats, LSD delayed the onset and decreased duration of REM by about 50%. This was shown in cats as well. BOL in the same rats, by the same group, also delayed the onset and decreased duration of REM sleep. It did not reach statistical significance, but there was still the same trend. This was just a single dose of the BOL, so who knows what a higher dose may have done. In humans, I found sort of mixed findings, but in general, well, I guess I can't really generalize, but in one study, a low dose of LSD, 25 micrograms, advanced the first REM period, so made him fall into REM faster. But this dose of LSD was given right at bedtime. In a lot of the studies going on currently, LSD or psilocybin might be dosed first thing in the morning to help, give a good study period. So this was given right at nighttime. It also increased how much REM there was compared to the slower wave sleep. In another patient, and again, this is an alcoholic patient, so not the same baseline brain chemistry, a large dose of LSD given in the afternoon, I think this was 300 micrograms, it increased REM duration. So the opposite of some of the animal findings, not just that night, but the subsequent 2 nights. So this effect was noticed over time. And then in an older study where LSD, 100 micrograms, was given first thing in the morning, they reported subjectively that their sleep was improved for the next 10 days. So a single dose, again, having a long-term effect. These patients were not hooked up or anything. It was just a sort of self-report of the sleep. So all these findings are sort of mixed. It's sort of clear that there are some effects. And it also seems important to not just measure the effects that night, but also subsequent nights, because the sleep and the hormonal system is sort of slower to act, it may not act right away. It may take longer for the effects to be seen. And the last part to talk about is the circadian cycle, which is obviously linked with sleep as well. As I mentioned, cluster headache is called cluster because the cycles tend to happen certain times of year, and the cluster attacks happen certain times of day. And this is a graph from a recent report showing when cluster attacks tended to happen. There's a difference between men and women as well, which again is a whole other lecture because there are some differences between males and females who have cluster headache. But in general, they tend to have their attacks in the middle of the night, unfortunately. So 2 a.m., 3 a.m., 6 a.m. And this is not for all patients, but most patients. Attacks can also be triggered by changes in your circadian rhythm. So changing shift work, jet lag, like some of us have currently. And then, of course, seasonal the reason that cycles probably come on during seasonal changes is because there's change in life duration, and then if you live in a place where the hours change, even that could be enough to set off attacks. And there's not much out there on what psychedelics do for for the circadian cycle, but I did find an older study where they gave LSD to house crickets and looked at their motor activity. I don't know whose idea this was, but this is over a 10-day period, and this shows the activity of the crickets. This is during the light period. Here's the light, and here's the dark, and then light starts up again. And crickets are, of course, nocturnal, so you see on this baseline day lots of activity overnight, and that's pretty much the same. They received LSD towards the end of the light period on day 3, and it didn't really change very much. And then a couple days later, they got LSD earlier in the light cycle, and again, it didn't do very much. It may have decreased their activity a little bit, but the following day, there was a big shift in their activity. So it's important that they measured not just the day up, but the following day as well. This went back to normal, and then they gave the LSD again at the end of the light cycle, and it did decrease activity some, but it didn't cause any shifts. So this is one of the only, I think this is the only study that I found about what LSD or other psychedelics might do to the circadian cycle, which I'd love to look at in patients who have cluster headache as well. So in what I've talked about so far, there's overwhelmingly this concept of cycling and day and night and circadian cycle in patients who have cluster headache. This is true to some degree for other headache disorders as well, but it's very strong within cluster headache. So I can't help to think that perhaps how psychedelics are working in cluster headache is sort of resetting neuroendocrine function, sort of breaking whatever generator there is for cluster headache. The specifics of that are still not known. All these data that I showed you are from other studies looking at in animals, patients without cluster headache, so much more work needs to be done. For instance, can a psychedelic normalize the increased activity in the posterior hypothalamus? Can normalize melatonin levels? Can they raise the threshold for triggering cluster attacks with things like jet lag and changes in the internal clock? And then are these effects mediated by serotonin 2A or some other mechanism? So hopefully I'll always have a job because I have a lot of questions to answer here. So there were a lot of references that went into just this project, and then I'd like to thank my mentors, and especially Dr. Andrew Sewell, whom some of you may have known, who sadly passed away several years ago. My current work wouldn't be possible without him, and my colleagues at Yale Psychiatry and also Yale Neurology. Thanks very much.